a chance to get settled in. We're going to talk about men and women's health. We're going to talk a little bit about prevention. We're going to talk about finding a great healthcare provider, preparing for an appointment, some information about testing that's really recommended. And then one of the things that I'm going to emphasize is how to be our own advocate in our very complicated healthcare system today. So if you can advance. Thank you. So one of the most important aspects, sorry, I feel so bad you have to do this. We're having a little technical difficulty here, and so I have Austin's great help to advance the PowerPoint. So one of the most important aspects to health and well-being, for whether it's men or women, for all of us, is to make sure that we are taking preventative care, right? Because it's always easier to prevent things than it is once we have something to find our way back to a place of health and well-being. So under the preventative care preparation, one of the things that we're going to talk about, and we're going to go into this in a little bit more detail, is knowing about your family history. And I know for some of us, that's a little more difficult, either because of our family situation or having those conversations can be difficult. But knowing a little bit about your family history can make a huge difference in the kind of testing that we get, in the way that our healthcare providers can actually track information for us and make sure that we get adequate care for whatever types of genetic or inherited conditions that we might be susceptible to. After we have that, and that can be an ongoing process, right? So things that happen to our parents, things that happen to our grandparents, things that happen to our siblings, those are the relationships that really make a difference, right? So if you have a sibling that has type 2 diabetes and you're doing okay right now, letting your doctor know that you have a sibling that has type 2 diabetes is the kind of information that's helpful. If you know that a grandparent died at, say, the age of 75 from heart disease or heart attack, very important piece of information. When you go visit a new physician, family history or your own history is also important, because that information may or may not be in a historical record within that either doctor's office or within the healthcare system. So the next step is choosing a provider. And I always think of this as finding someone who's on my team, right? I don't go into a doctor's office, and none of us should go in and just surrender ourselves to whatever they think is the best course of action. We need to take an active role in that. We need to prepare, we need to let them know things that are happening in our life, symptoms that we may be experiencing, whatever it is, and we're going to talk a little bit more about that. But choosing that provider who can be on your team to help you find the best health and well-being path forward. And then taking some time to prepare for your appointment, especially when you're going in for a preventative situation. We have the information that we need if we're going in and we think we have COVID, or we have a sore throat or a high fever or something in particular. But when we go into those preventative appointments, oftentimes we forget everything that's been happening for us. We may forget that we've been struggling with sleep. We may forget that we all of a sudden are having digestive issues. And they sometimes refer to that as the white coat syndrome. Walk in the door and all of a sudden we forget all those things that have been happening in our life. So one of the things that I like to do is you can either keep a pad of paper, a small pad of paper that you keep in your wallet or your purse, or make notes in your smartphone. And whenever you go into the doctor, you can just pull up those notes. I know they don't want us on our phone, but this is a very legitimate use of a smartphone. But pull up whatever it is that is bothering you so you can discuss it with the physician, especially when you're in there for preventative, because preventative, they usually have a little extra time. When you sneak in because you have some kind of acute illness, right? You call at the last minute and you've got a really high fever or you've got signs of an infection, they may wedge you into an appointment. But if you're there for prevention, they usually have 15 to 20 minutes set aside for you. So it's a great opportunity to have a more detailed conversation. In addition to that, on an annual basis, there are screenings that all of us should have. And we're going to talk a little bit about what that means. Very similar for men and women, but there are some nuances, and we're going to talk about that. But getting screenings is important. And one of the fallouts of the pandemic is that a lot of doctors' offices are short-staffed. And so where before they were already dealing with a complicated situation, now things are even more complicated since the pandemic, and a lot of offices are short-staffed. So what happens is your doctor may order a screening, but then nobody follows up with you. And so you need to think of this in terms of being your own advocate. What are the things that I need to do that the doctor thinks are important screenings? Do I need to have my blood pressure checked? Do I need to go and get a stress test for my heart? Do I need to go and get a colonoscopy? Whatever the test might be, making sure that you know what has been ordered for you and that you follow up on that. And I know that that can seem overwhelming. And some doctors' offices are right on it, and they will follow up and make sure you get that secondary appointment or get in with that specialist that you might need. But sometimes it falls through the cracks, and so it's really important that you take responsibility and ownership of getting those screenings done as soon as possible. And then follow through. So whatever the results are from those screenings, oftentimes doctors will send that information now, either through an app or a health record piece of software, or an email, whatever, or a phone call, and let you know about your screenings. Now, if there's something really outside the norm, that doctor may call and schedule another appointment for you to come in, like if your blood pressure is too high or your cholesterol numbers are really high, they may actually schedule a secondary appointment. But it's so important that you're following through, that you understand what the test results said and what it is that you're supposed to do next. Even if it's everything's great and you need to follow up in another year, which hopefully is the best follow-up that we get. And there are times when we're going to need to make a change. So if you find out that you are right on the border of diabetes type 2 and that you're pre-diabetic, there's some really important changes that you might need to think about in terms of exercise or nutrition. And so as part of the prevention, again, is making sure we stay on that side of health and well-being and not move into a disease state or a chronic disease. And then keeping it on track. So maybe you get all great test results back, but you need to schedule that appointment in a year. It's good if you can do it right then and there. Not all of us can do that because our schedules can be chaotic, but then making sure you put reminders in your phone, on a calendar, tell somebody else, whatever the case may be, so that you make sure that you get that follow-up appointment. So next slide. And as we go through this, if you have a question or a thought or something you want to share with your colleagues, please feel free. So I want to talk a little bit more in detail about what kind of information you should be collecting for your family history. And a lot of us don't really spend a lot of time doing this, but there's an important reason why it's worth a little bit of time and effort, because there are things historically in your family history that may be indicators of genetic predisposition for them. So type 2 diabetes, hypertension, arthritis. And the reason that we bring this up is that if there was nothing that we could do about it, then it wouldn't matter. But so many of these conditions that you could be predisposed to, there are really robust ways to make sure that you don't fall into the disease state. There's lifestyle changes, there's ongoing testing. So I like to think of this preventative step as fully worth it. So we look at the family history. The important family relationships are parents, grandparents, and siblings. Those are the closest relationships. Occasionally something sometimes shows up with our children that they could have inherited from us. Don't show symptoms, they do. So occasionally there are things like that. And of course, within the family history is your history, right? So if you're seeing a new physician, anything that has happened, any kind of care, surgeries, medical conditions that you've had, how many children you've had, those kinds of things are really vitally important. And then looking at chronic disease in particular, because this is where so much can be done if we can find out early and keep people on track. So things like type 1 diabetes is juvenile diabetes, and that's an endocrine system issue. It's not the same thing as type 2 diabetes. Type 2 diabetes is more lifestyle. It also has a predisposition genetic component. So making sure that you have that information available for your healthcare provider. High blood pressure. High blood pressure is so important to track, because if we have high blood pressure and it is not monitored and clinically taken care of, either through medication or through lifestyle changes, it can predispose us to stroke, heart attack, a lot of really catastrophic things. So monitoring and understanding your blood pressure and the history of your family with blood pressure is important. Any kind of high cholesterol, so things like your HDL, LDL, triglycerides, those are all things that we're going to talk about well, we're not going to talk about it in detail today. We've talked about it before, but cholesterol numbers are important. So if your family has a history of high cholesterol, you may be predisposed to high cholesterol as well. Stroke, a history of stroke, heart attacks, cardiovascular disease, headaches, and arthritis. All of these things are considered kind of the big umbrella under chronic disease, and knowing your family's history is important too. So again, parents, grandparents, and your siblings. And then any history of cancer, heart disease, and autoimmune conditions. Conditions like multiple sclerosis, lupus, those are considered autoimmune. There is a strong genetic component in autoimmune conditions, and not everyone manifests them. So knowing that your family history has something, your doctor will maybe even order some special tests that you wouldn't normally take on an ongoing basis. And then immediate relatives, so again, those parents, grandparents, and siblings, the age at and the cause of death if they have passed. And this is very critical information, because it not only tells the history of potential genetic predisposition, but also the catastrophic effect, right? The severity of your family's experience with that. So, so having that information is really, really important. And then any history, and we oftentimes skip over this, of depression, anxiety, and mental illness. There is a component, a smaller component of genetic predisposition for those things. It can run in the family. It can be genetic. It can also be environmental. And so having that information and sharing it with your family, and also gathering this information for yourself and also for your children. So as they get older, I have 2 adult children, I gathered all this information and I put it to them, sent it to them in an electronic format, and encouraged them to save it in their notes. Plus I also have a copy if anytime if they need it. And then there's a really great resource right here. The CDC has a great, robust tool that you can utilize to have these kind of sometimes difficult conversations with family members. Sometimes people don't want to talk about family history of health and well-being. I know I had an aunt who really didn't want to talk about it. She had some kind of information that I needed since my mom had passed, and I didn't know who else to talk to about it. Eventually we were able to find a way to talk about it, but it can be hard. And so this CDC resource is a great way to kind of find a common ground and a non-threatening way to discuss things that might be difficult for some people. Any questions so far? Okay, let's go on to the next slide then. So what are some ways to choose a provider? I wish that we had in healthcare the same kinds of robust tools like we find when we want to buy something on Amazon, or if you want to check out a restaurant, right? There's so much information. There's community-based resources. There's, you know, if you wanted to go to a restaurant, you could find out what other people are saying. You could also check with the health department and find out how well they're doing. Is their kitchen clean? Do they have any violations? There's lots of great resources to choose something as simple and straightforward as a restaurant. But finding a great healthcare provider, good luck, because you're kind of on your own, right? So the main ways to find a provider, the first and foremost, is if you have a healthcare provider, say you have a great OBGYN, and now you need to have a new primary care physician because whoever you were seeing retired. Getting a referral from that doctor that you already trust is key. That is the first step of referrals. Also, if you have a great dentist or you have a great orthopedic person because you had a hip replacement or a knee issue, but you need that primary care, or you need an OBGYN, or whatever the case might be. Start with a clinical person that you're already dealing with, that you trust, you have a great relationship with, and see if you can get a referral. Always making sure that you check with insurance companies so you stay in network. Make sure that you stay in network to get the absolute most amount of benefits that you can and minimize any out-of-pocket costs. And also staying within the network helps make a better and more robust health record in one place. And that can be very crucial as you move down the road. There are some rating services that have been utilized in other industries, like Yelp. I didn't even know this until 2 years ago, that Yelp has a resource where you can check out physicians and some types of clinical places. Like if you want to get a mammogram, especially in Northeastern Ohio, there's some great information about where you should go to get something like that done. What are the costs? How fast, how quickly can you get in for an appointment? So some great information can be helpful. Also Google. So if you get a recommendation, either from a referral, checking with your insurance company, and maybe somebody, your neighbor tells you about somebody, Google that doctor's name. And one of the things that comes up is their ratings on health grades, and sometimes the Yelp information about people's experience with them. Google is a great, I mean, we Google everything, right? We actually, when I think back 20 years ago, the word Google didn't exist other than to be the word for a really large number. Google is now a resource for finding out as much information as we can. Since there isn't a great repository of healthcare information, we utilize the tool that we have at hand, and Google is it. And you will almost always find, for a physician who's been practicing for at least 5 years, some feedback about their quality as a physician. Now, just remembering, you don't know who it is that is giving this information, right? It's somebody who's seen them as a patient. That information may or may not align with what you're looking for in a physician, but it's one more piece of information to try to utilize. And then a lot of the health systems like the clinic in Northeastern Ohio and university hospitals and SUMA also have an internal rating system for physicians. They will tell you things like the languages that they speak, their areas of expertise, are they taking new patients, what are the areas that they normally practice in, right? Do they focus on people over the age of 65? Do they focus on young adults? Whatever the case may be, this information can be really, really helpful. And then finally, make sure you call and check with the provider. And you're not just calling to make sure, one, that they're taking new patients, and two, that they're in the network that you have for your health insurance, but you're also checking to see what the experience is like talking to them, right? If you call the office and you're put on hold and all of a sudden you realize that they forgot that you're on hold and it's 10 minutes, maybe that's not the right place. It could be that it was just a bad day, so you might want to give them the benefit of the doubt. But if they pick up the phone and you say, I would like to maybe become a new patient to this doctor, what is the process for that? And just pay attention to how they deal with you, right? How do they answer your questions? How do they approach someone who's asking them questions out of the norm, instead of just calling up and making an appointment? And say, how long does your provider actually set aside for a new patient visit? Is it 10 minutes? Is it 20 minutes? Is it 5 minutes? Pay attention to how they're answering the question. If they say it depends or I don't know, maybe see if you can talk to somebody else in the office. But that's crucial, because remember, not only are you dealing with the provider, but you're dealing with their staff. You're dealing with the environment there. And when you walk in, you want to know that you have a whole practice that you can depend on, that you can trust. I thought I turned it off. I was like, oh no, it can't be me. All right, and then preparing for the appointment. And so often we don't do this because we're all so busy. But I think it's worth it to take that time, right? We make sure that we get that family and personal history, but we take some notes and bring things that we want to talk about, even if we're just going for a wellness or a regular checkup. Maybe you've been struggling with sleep and it's not a clinical issue, right? You're still going about your daily life, but it's annoying that you're not getting sleep, and it is something to discuss with your physician. Maybe all of a sudden you notice that your knee is bothering you more than it has in the past. These are things to make sure that you make a note of, so when you meet with the physician, you can talk about them so they can check it out. Maybe you need to get a CAT scan or an x-ray on that knee, and maybe it's something simple. Maybe it's arthritis, who knows what it is. But making sure that you have some notes and that you bring that to the appointment will help you get better care down the road. And then details of any concerns. So just like we've been talking about, taking notes, bringing them with you, any concerns that you may have, why did you come see them? If it's a preventative care appointment, maybe you don't have anything going on, but you want to share some of those concerns from your family history, because maybe your father had a heart attack at the age of 50 and you're 40. And you want to make sure that you're getting all the right care so that that doesn't happen to you. And then check in with the provider for any special prep. I mean, we're so busy today that if you can go to the doc and you can get your blood work done and some testing done all on the same day, right? That is a huge time saver, rather than going to the doc and then making a separate appointment to go get blood work and then making a different appointment for, who knows, colonoscopy or whatever. See how much you can do while you're there, right? Because a lot of physicians' offices are in medical centers where they may have a place where they can do blood draw, and maybe you need to fast. Maybe you need to not have eaten anything in order to have that blood work. It needs to be fasting. So it helps to have that conversation and find out if there's anything that you can do. Let's go to the next one. So now we're going to talk about the screenings for men and women. And there's a lot of overlap between the two. And these are kind of generic, not generic, that's not the right word. These are recommended for the average adult, right? No special, not considering family history, not considering genetics, not considering anything that's already happened to you. Just in general, these are the things that you should check on an annual basis. This is the baseline data that is essential for us to be able to track our healthcare overall. So let's talk about women first. So you want to have your blood pressure checked, and if there's any variance in your blood pressure, like it's too high or it's too low, your doc should be taking your blood pressure while you're sitting, standing, and lying down, because that tells a lot of robust information. Newer physicians trained in the last 15 years, are routinely doing this for anybody with a variance in their blood pressure. So if your blood pressure is 110/70, they're not going to need to do this because your blood pressure is right in the sweet spot. But if your blood pressure is 110 or 130/100, then this is even more vitally important. Changing position, and that, or if you notice that you've had dizziness, right? So we get up from a chair, we sit down, we lay down, we get up, and we notice that we're dizzy. That's a key piece of information to take a note about. And it's also another reason for the physician to check your blood pressure in changing positions. This is being done more because we're finding the cue of an early cue of a later blood pressure problem by changing positions. So it could be 120/80 while you're sitting, and when you stand up, all of a sudden it drops 20 points and you feel lightheaded. Can be pretty impactful. And at the minimum, they should be checking your heart, your lungs, your ears, your eyes, your nose, and your throat annually. Again, these are all places where we can get early indicators of what is happening. And you'll notice for eyes, it's oftentimes the physician will actually take a bright light and this thing, and they get really close to us right while they're looking in our eye. They're actually looking at the optic nerve. And changes in the optic nerve are early indicators of things like high blood pressure or cardiovascular disease. The eye is very sensitive. The nerves and the blood vessels are very sensitive to any type of distress in the system. And so they are great early warning systems for cardiovascular issues. So these are the annual things that you want to have checked. And if for some reason your doctor doesn't check those things, ask them, why? Are you going to listen to my heart? Are you going to listen to my lungs? Right? Make sure you have that conversation. One thing I want to add in here, and this is a whole separate discussion because it's not taken care of in a clinical medical professional's office, and that is that you need to go to the dentist at least once a year. Again, your mouth, your teeth, your gums are early warning systems to bigger problems. And making sure that you go to the dentist is important. I have it down here, but it's kind of separated. I don't know why we do this in healthcare, that going to the dentist is completely separate from seeing your primary care physician, but it is. And it is also very important, not only to make sure that if you're having any dental issues like bleeding gums or swelling of the gums, all indicators of inflammation in the body, again, important early warning system for other things like heart disease and blood pressure. And then moving down into blood work that's done, checking for cholesterol, and usually there's 3 things that they check for: your HDL, your LDL, and your triglycerides. And those 3 pieces of information about your cholesterol tell the physician how well your body is doing with 2 things: fat and inflammation, right? How well the body is processing fats and how well the body is managing whatever inflammation is happening. And then fasting blood sugar is one of 2 markers that they use to determine whether you are considered type 2 diabetic or pre-diabetic. So in addition to fasting blood sugar, they'll also do an A1C. I don't put it up here because they don't always do that. And then HIV if you're sexually active, and a CRP, which is also another marker for inflammation in the body. I keep thinking it's my phone. It sounds just like my phone. And then vaccinations, and here I don't want to get into any kind of controversial thing related to COVID, but I want to draw your attention to 2 vaccinations in particular. For most of us, if we went to school in the United States, we have had our as adults, we've had our immunization. But there's 2 things that I want to draw your attention to, and the number 1 thing is shingles. Has anybody here had shingles? I had shingles. It's horribly, horribly painful. Now I know people who had shingles and it was no big deal for them. And then I know people who actually had shingles and were hospitalized. I was somewhere in between the 2. I managed it at home, but it was a really, really painful experience because shingles is caused by the same virus as chickenpox, and it affects the nerve endings, right? And if you've ever hit your elbow just wrong and you feel that nerve pain go up and down, imagine that for 10 days straight on your back or on your chest or on your belly. I have my really good friend who, she is one of the toughest people I know. She's a physician. And she was in so much pain with shingles that she had to be put in sedation in the hospital for 2 days because she was crying out in pain. And they didn't want to sedate her with painkillers, so they just simply put her in mild sedation so that she would sleep through the worst of it. And then 2 days later, they woke her up and the pain had passed. But we're talking extremely painful. And the shingles vaccines that are available today, make sure you have a discussion with your physician if you haven't already had it, because there are some counterindications to having the shingles vaccine, but they're very minor, and it is extremely effective. It didn't used to be extremely effective. It used to be like 50%, and now it's closer to almost 90% effectiveness. Shingles, please don't get shingles. Tetanus is the other one, especially if you're working outside. Now, if you go into the emergency room and you have a gash on your foot or a gash on your hand or you've broken a bone and the skin has been pierced, they will automatically test your blood for whether you've had a tetanus vaccination or not. But it is helpful if you're outside to make sure that you get a booster every 5 years just to be proactive, because what happens is that some people have a big gash and they try to treat it at home and then it gets infected. And unfortunately, one of the bad side effects of Some of the things that have happened in hospitals is that we have these infections called MRSAs, but infections that actually originate in hospitals, so super infectious bugs. And if you have a small cut and you don't have your tetanus vaccination, it can become a full-blown, full-body infection. So it's helpful, especially if you're working outdoors, that you get your tetanus and you get it every 5 years. And if you go to see your physician on a regular basis and you have a relationship, they will make sure that you have that on a regular basis, but it's helpful to have that. Want to get a skin cancer check every year. Skin cancer is on the rise. And just like knowing your family history for chronic disease, there's so much they can do if they catch skin cancer early. Lots and lots of great surgery and procedures and medications that can be done to take that skin cancer and move it from a really scary catastrophic situation down to something really minor that can be handled quickly and in the doctor's office, but only if you know in advance. It's those things that linger, right? And so for skin cancer, the main things you want to think about are changes in shape, size, pain level, and if they bleed. So you can have something like a mole and all of a sudden something happens. You want to make sure that you go and get that checked. But this is a preventative skin cancer check every year. More and more primary care physicians are doing that. They usually have a nurse practitioner on staff who will do a quick body check for you. Colorectal screening is suggested after the age of 50, unless you have had a history or your family's had a history of colorectal issues. So if you've had a sibling or a parent or a grandparent that had colon cancer or bowel cancer, colorectal screening is usually starts at 35 and is done every 3 to 5 years. So that's one of those places where having that family history can make a difference in how frequently you have screening and the likelihood that they could catch something early. And then of course for women, breast and cervical cancer checks it's between 1 and 3 years, depending on your risk level, cervical cancer, sexual activity level, your age, lots of different dynamics. The AMA recommends every 3 years right now. And then an HPV and a pap smear annually for sexually active adults. And then of course the dentist, because we forget, and dental care is very important. So those are screenings for women. Any questions, any thoughts? Okay, so let's go to the screenings for men. And there, as you can see, there's a lot of overlap. One back. Yeah, that's okay. So screenings for men, again, blood pressure, the check of heart, lungs, ears, eyes, nose, throat, cholesterol, fasting blood sugar, HIV, CRP, vaccines, and skin cancer, colorectal. For men, annual prostate exams usually start over the age of 35, unless you have a family history of prostate cancer. And right today, as we stand here today, many forms of prostate cancer that were, when found early, are almost completely curable, and people will have a normal lifespan. So that's really great news. So the earlier you find it, the more likely it is to take it from being a catastrophic situation to something that can be managed, and you can move on with your life. One of the things that's different here for men versus women is that primary care is now being encouraged to screen every man over the age of 40 for depression. Just like skin cancer rates and chronic disease rates are on the rise, so is depression for men. And there is a very strong clinical hormonal connection for many men who have depression, and it can be related to the hormone testosterone. There's lots and lots of things that it can be related to. It doesn't have to be a family history. It doesn't have to be a genetic thing. It can be very hormonally related. And so depression screening is very important. And because men's symptoms in general, right, I'm speaking in generalities, present very differently than women's depression issues, oftentimes it just goes unaddressed by the individual themselves. It's unnoticed by family. And there's so much, again, so much that can be done today There's medications, there's lifestyle changes, there's therapy, there's so many things that can be done to help someone who's dealing with depression. And that's why the screening is important, because if you catch it early and you start on therapy, life gets better. Sleep apnea, many people snore. And just because you snore doesn't mean you have sleep apnea. But if you sleep near anyone else and you've been told that you snore, you should tell your physician, because you should be screened at least on a piece of paper for the indicators of sleep apnea, and you might need to have a sleep study. And it's worth it, because sleep apnea makes us tired during the day. It can actually lead to depression. So sometimes that depression screening will actually alert the doctor that you may have sleep apnea, right? You can be depressed if you're constantly sleep deprived and exhausted, and life is more of a challenge, right? If you don't get good night's sleep the night before, or for the 7 nights before, life is so much harder that day. And that can lead to chronic disease, it can lead to heart disease, it can lead to cardiac arrest. Sleep apnea is not to be messed around with. And again, great new therapies. It's not just about putting that big, bulky CPAP machine that if you've ever seen anybody who slept with them, or they've even been on TV shows where somebody has a big CPAP machine. They have much more elegant, simpler solutions, less impactful to anybody else who might be sleeping with you and to you personally. So sleep apnea, big issue, really nice, simple fixes for it in many cases. And we don't want to forget to see the dentist, because again, the teeth, the gums, the tongue, the throat, all early indicators of problems. So any thoughts or questions? I'm giving you all kinds of information because I want to give you as much as we can, so that when you go to the doc, hopefully some of this will stick with you. So the important tests, I want to go over this one more time. Fasting blood sugar and A1C together are the 2 tests that determine whether you are a pre-diabetic or a type 2 diabetic. So making sure that you have them, especially if you have a family history of them, or if when you were pregnant, you were diagnosed with gestational diabetes, you are more prone to type 2 diabetes. So making sure you get those done annually, more frequently if there is anything that comes up in them. And then cholesterol, there's the LDL, the HDL, the triglycerides, and the total cholesterol. CBC is one of those panels that's generally done, and the information that shows up in that are additional indications of inflammation, but also signs that there might be an infection or something else going on in the system. So the CBC and the TSH is if you're having any issues related to your thyroid. So it could be something like weight gain, weight loss, energy level, foggy thinking. So having the thyroid checked. And it's just referred to as the TSH panel. And then follow through, and talking about being your own advocate, this is where it makes a difference. So you can get your family history, you can go find a great provider, you can go to the doctor. But if your doctor orders some blood work and some tests and you don't get them done, you're really lacking in important information. So making sure that you follow up with whatever screenings are recommended in the blood work. Make sure that you make any follow-up appointments. Sometimes it's not even necessary to go in. Maybe you just need to have a quick phone call with your doctor, especially when the information comes back on your blood work and your screenings. We don't need to be an expert on all of those details. We just need to know, what do we need to do? And then what is the number that's a problem, so we can keep track of it over time, right? If your blood pressure is too high, it's 130/80. And then the next time you go into the doctor, it's 125/79, right? You're headed in the right direction. So, but if you go back the next time and it's 135/100, then you know you're going in the wrong direction. So having that general information, also known as knowing your numbers, is a very important thing. And it's something we need to be responsible for, because the complex healthcare system that we all benefit from and also are held hostage to in many cases. We need to make sure that we are our own advocate. And then make sure that you have your follow-up appointments, follow through on any results, right? So maybe your fasting blood sugar and your A1C came back and said you're in the pre-diabetes range. So what do you need to do? Maybe you need to see a nutritionist. Maybe you need to see a dietitian. Maybe you need to change your exercise routine. Maybe you need some help with your sleep. Whatever it is, make sure that you check in with your provider and you get that follow-up care, because a lot of times there's that disconnect, right? We get the test done and then we don't take action. And action is where we can make a difference. Action is where we can really take ownership of our health and prevent something really catastrophic. But I like to think of it as preventing pain and suffering in my own life and in the life of people that I love. So let's go on to the next one. So what are some changes, and we've talked about this. So if you've been coming to my sessions last year and this year, then you know that we've talked all the time about eating right, eating healthy, moving the body, getting great sleep, managing our stress levels. We've even done something on meditation and mindfulness and all kinds of things. But here are the things, no matter what, say you got stellar blood work back, all your tests were perfect. Doing all of these things or any one of these things will make sure you stay on that path. But if you also found out that you're a pre-diabetic, doing any one of these things can help you from being a full-blown type 2 diabetic. So number one is to eat more plants. I'm not saying that anybody has to be a vegan or a vegetarian. I am not a vegan or a vegetarian. But eating more plants and kind of making that your priority every time you sit down for a meal, making sure that that's the first thing you put on your plate, and then putting those other things, the kind of comfort food that makes us feel good or things that we really enjoy, thinking of them as entertainment, right, or comfort, but making plants kind of the most important, fueling your system in really powerful and vibrant ways. And then making sure we move throughout the day. For some of us, it's easy. So like when I talk to the fire department or the police department, or when I'm talking to people out who are working in ground maintenance, they're always moving, right? So they're always moving. But for some of us, we're sitting for really long stretches of the day. And the risk factor of sitting for 4 hours or more every single day is the same risk factor, the same impact on your health as smoking. Yeah, scary stuff. So moving more throughout the day, right? You can go and work out in the gym in the morning, and that's awesome, but you gotta make sure you get up during the day and stretch and go for a walk and take some stairs and move around and go for a walk in the evening, maybe after dinner, before you go to sleep, take your dog for a walk, whatever it is. Make sure you're moving your body throughout the day. Try not to sit for more than 1 hour at a stretch without getting up and moving around. Human bodies were not meant to sit for long periods of time. And then build strength, and this is essentially important, so important once we're over the age of 50. Because once we hit 50, there is a decrease of about 1% reduction in strength every year after that. And for some of us, it's worse than 1%. But on average, we lose about 1% of our strength every year after the age of 50. Why are you laughing?
Because when I hit 50, I noticed that every year I lose more and more strength. And I tell my kids, I don't have the strength that I used to have. They used to see me moving furniture, refrigerators, stoves, couches. It's not a problem. Now, better get a dollar and ask somebody else, but it really happened with me no more.
Yeah, I don't recommend that you volunteer to move your kids in and out anywhere, but building strength on your own, just, keep that on the QT for yourself, that you're continuing to build strength.
See, I'm a mover. I mean, I like to stay active.
Mm-hmm.
Like I had a meeting like when you first started the slides. So they would tell me I need to stretch before I get out of people's vehicles, and I probably wouldn't have an injury.
Right. Stretching, you know, strength building strength is so important. So I'm looking at my 60th birthday, and I make strength training every day a priority. I train a different part of my body every single day to try to, you know, keep some of that strength. Yeah, so it's important. You know, a lot of people, young people, it's like age is a protection against bad decisions. age, you know, being younger is a protection against eating too much McDonald's or staying up too late or drinking too much alcohol or partying late into the night, not getting enough sleep. But once we get over 35, 40, every year, those behaviors have really catastrophic effects. And so taking that extra time of moving more throughout the day, which it sounds like you already are, but really making a conscious effort to build back strength. I am so inspired, like, you know, TikTok, and I don't really like social media that much. I find it really distracting for me personally. Like, I'm easily distracted. It's sort of like a dog sees a squirrel, it's like squirrel. But what I love about Instagram or TikTok is that you can follow these people that are in their 80s that are building strength and exercising. And I find them so inspirational, so inspirational. And so maybe you'll find that too. And there's some really great trainers out there today who know and have trained and have studied how to work with women in particular over the, you know, especially once we're through menopause, how to help us to keep strength. Guys have testosterone later into life, and testosterone is a great protection for muscle strength and joint strength that we don't really have. We have a little testosterone, but not to the degree that men do. So moving more and building strength, crucial. And then quality sleep can't be underestimated. Sleep is a magic recipe for health and well-being. Making sure that you breathe free. So if you are smoking or vaping or anything like that, that's considered low-hanging fruit to improving your health, to get those things out of your life. And there's great resources available through your health plan to make sure that you have some resources to help you. And just like eating more plants, cutting sugar and processed foods. So this has to do with the standard American diet. Have you heard that? The SAD diet, which is what we all eat. The SAD diet, the standard American diet. Because it is really, really, it has so much processed chemicals in it and high levels of sodium and sugar and processed wheats that are stripped of any nutritional value, that food is a main driver of both obesity and chronic disease. And so doing things like eating more plants, these are simple things, right? I don't like complicated diet things. Eating more plants and cutting sugar, processed foods will make a huge difference. And then finding something that relieves our stress. It can be something different for everyone, right? It could be knitting or needlepoint or playing with your grandbaby, or taking your dog for a walk, meditation, mindfulness, Tai Chi, whatever it is, something that makes you feel peaceful. Because when we're in that peaceful state, there is a chemical reaction that happens through the body that activates our parasympathetic nervous system. And that's the part of the nervous system that says, I can rest and I can digest. And we want to get into that state as frequently as possible. There is the thing for the sympathetic, right? You know, run, hide, fight, whatever we need to do. There are times we need to be in that place, but for the majority of time, we should be in that calm state. And having these things in our life that we can rely on is really helpful. Walking in nature, powerful combination, right? And then find a hobby. I mean, if you already, a lot of us already have hobbies, especially as we get older. Again, a hobby can be something that also relieves stress, right? It could be something that we're doing with a group of people that make us feel good and we feel supported and seen and connected when we're with them. Spending time with friends and family, taking a vacation. Sometimes even a staycation can be wonderful, right? Don't try to overdo it with 85 different things on your to-do list at home, but take a vacation, take time off from work, take time off from your daily routine. And also volunteering is a really helpful thing. I recommend volunteering all the time when I talk to younger people, because their high rates of depression and anxiety are often relieved when they get connected to the community and start volunteering. Any thoughts on any of that? So it makes sense, right? And if you made any of these changes or added anything like from this list to your life, even if your blood work and everything was perfect, you would be in a better place. You would feel better. You'd have more energy, more vitality. You'd have a more robust immune system. All of those things, anything on this list can help move us in that direction. And then the next slide. And then just one more time, keep it on track. Track your numbers. So if you know you have an issue with your blood pressure or your family history of it, make sure that you're tracking it on a regular basis. There's some great apps to use. Your healthcare provider, like Epic and like Clinic and UH both use Epic. And there is a patient portal portion where you can look at your blood results and your test results and look at them over time. That's really helpful if you're in the same system. If you switch from one system to another, not so helpful because you can't necessarily get that data over there. So tracking your numbers and looking at it over the long haul. And then keep a diary of symptoms, as we've talked about already, using your smartphone or a piece of paper. Educate yourself. So if you know you're a pre-diabetic or you know you have high blood pressure, you need to become an expert on what does that mean and what can I do to make my life better, to prevent a serious catastrophic chronic problem from impacting my life. Making those lifestyle choices, some of the ones we just talked about on the page before, like eating more plants and more exercise and weight training. Take charge. Don't rely on your healthcare provider, your doctor, to be the one in charge, because they may be seeing 800 to 1,000 patients in a month. That's a lot of people. You are not going to be their priority. Even if they wanted to do that for every patient, they just physically couldn't without not taking care of themselves. And so making sure that you are in charge of your own health. And if you have, younger people in your house or, other people in your house, you're probably taking care of more than just one. And make sure you're following up with the provider. And the last one is a really hard one for a lot of us, and that's to ask for help. When you get some blood work or you get a test result back and you're not exactly sure what to do, ask for help. Talk to your doctor, talk to the nurse in the office, talk to your friends, look for resources in the community, talk to HR about your health plan, find out what resources are available there. Keep on track by taking control and taking responsibility. And the next one. And here's some information. So if you want to understand more, like you get some blood work back and you're not exactly sure, there's a lot of resources out there. Some of them are not so great. I have vetted both of these resources. They're top notch. And they have really great information about what does the blood work mean? What do those results mean? What do you need to do about them? And then the next page is some more information about preventative care. So healthcare.gov, the US Preventative Services Task Force, really, really great, robust resource. Screening information for men and women, and those are separated. Again, really great resources there. And then the last page is just my contact information. So if you have something that you want to talk about and you didn't want to talk about it in this room, and I completely understand, you can reach out to me and I'm happy to connect you with resources that could be helpful. It might be something related to your health plan or whatever other resources that I can bring to the table for you. And I'm happy to do it. And almost every time I present, I talk to at least one person afterwards. So don't feel like you're imposing, because you're not. I always feel better. Like I'm that kind of person that I feel better if I can help someone find a solution. Because my parents suffered. They had cancer and chronic disease and all kinds of really difficult medical conditions. And if I could have known what I know today and prevented some of their suffering, it would have been a great thing. So now I just try to do it for someone else. So take good care of yourself, take good care of your family, and I'm here if you need me. Okay, thank you. Thanks. Any questions online too, or Zoom? Anybody have a question? I didn't see anything in the chat. So. Okay.
At what age should you get the shingles, start getting the shingle vaccine? Or is it one shot, or is it still a few shots?
It's two shots. And It depends, so it's for those of us who actually had chickenpox that it's most important to get the shingles vaccine. And the younger people are less impacted because they actually got the chickenpox vaccine, and that's not 100% effective against shingles, but they're less likely to get it. Those of us who actually had chickenpox as kids are more susceptible to shingles as the second go round of it. But once you've had it, you don't ever get it again. So I was really grateful to hear that. So I don't know how I would have done if I got that again.
My brother had shingles when he was 19.
Really?
Yeah, and it was ugly. It was not a huge rash around his trunk, and he was in a tremendous amount of pain.
Yeah. And some people don't even get a rash. So my friend, the doc, she didn't even know that she had shingles because she had no skin disruption at all. And it wasn't until she was in the hospital that her body broke out in the traditional shingles, skin issue. Yeah, weird. It just happens, everybody's different. Any other questions, comments, something to share with your colleagues? Thank you so much.
I highly recommend volunteering, either through your church or some other nonprofit, or even in your own neighborhood, picking up trash once a week. It definitely, for me at least, it gives some purpose.
Mm-hmm. Yeah, I really encourage young people in particular to do that, because a lot of them are struggling to make connections in the community and to be in the real world, like the 365 or three-dimensional world, and so volunteering is an opportunity to do that. Thanks so much for taking the time out to come and visit. Last time I was here, only one person came, so I'm so glad to see everybody. Austin's here too, but
Thanks, Melissa.
thanks everybody. Thanks so much.
Thank you.